Welcome to Doctors on Call. I'm Jenna Miller. Chiropractic is a healthcare profession that focuses on disorders of the musculoskeletal system and the nervous system and the effects of these disorders on general health. Chiropractic services are used most often to treat neuromusculoskeletal complaints, including but not limited to back pain, neck pain, pain in the joints of the arms or legs, and headaches. Doctors of chiropractic, or DCs, practice a hands-on, drug-free approach to healthcare that includes patient examination, diagnosis, and treatment. Chiropractors have broad diagnostic skills and are also trained to recommend therapeutic and rehabilitative exercises, as well as to provide nutritional, dietary, and lifestyle counseling. Chiropractic care and sports therapy, that's our topic today on Doctors on Call with our guest, Dr. Lindsay Gallion.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Lindsay Gallion, D.C., earned her bachelor's degree in kinesiology from Kansas State University. She earned her doctorate from Cleveland Chiropractic College, graduating with honors. During her time at Cleveland, Dr. Gallion spent much of her time in postgraduate seminars for active release technique, Graston technique, motion palpation, activator technique, kinesiotaping, and sports injury rehabilitation. Prior to Russell Chiropractic and Sports Therapy, she served at KC Core and at a private practice in downtown Kansas City. Her clinical focus is on the treatment of soft tissue injuries through myofascial release, improving body biomechanics, and correcting muscle imbalance. Give us a call at 1-800-337-4788 toll-free with your medical questions about chiropractic care and sports therapy today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or chiropractor. Thanks so much for joining us tonight. We'll go ahead and get started with some of our own questions. First of all, let's talk about why a person should choose chiropractic care.
Sure. Well, basically, most people associate chiropractic care with the acute types of pain, such as, you shovel too much snow and strain your back, those types of pains, or chronic headaches, but we also treat chronic and moderate types of pain.
Mm-hmm. Sure.
Yes.
And how does a person go about selecting a chiropractor?
Good question. Most of the time that is based on need and what you're specifically looking for in care. So if you have something like a sports injury type of complaint, say a tennis elbow or golfer's elbow, you should really focus on looking for a physician that has some sort of musculoskeletal background. Mm-hmm. For instance, a Graston or an active release type of certification.
Okay, now talk about, do different chiropractors adjust in different ways?
Absolutely. Mm-hmm. So most of the people that graduate in the Midwest, we do what is called a diversified technique, which is what traditionally people associate chiropractic with, is the osseous pop. So we have that type of a chiropractic adjustment, which is a high velocity, low amplitude, where there's a thrust into a joint to create motion. Other types of chiropractors do what is called tool-assisted adjusting, where they use a spring-loaded tool to adjust. And it's basically segment-specific, where they put the tool on top of a segment that's restricted and use an activator. Mm-hmm. So.
Now, is there pain involved when you go to the chiropractor?
I would say yes. It shouldn't be painful long term. Mm-hmm. The type of chiropractic that I do that heavily relies on muscle tissue manipulation does create some pain following an adjustment, because I'm working on tissue around the area that is inflamed. So when you have an area of injury, just like if you hit your elbow and you have a bruise, if you touch that area, it's painful. Mm-hmm. So part of the time when you work on a painful area that is injured, it's going to cause some pain, but it shouldn't be long lasting and should mostly be comfortable.
Now, on the flip side of that, what might be a negative if a person is maybe hesitant to go because they're afraid of what the pain would be like? What might be a negative side effect of not going at all?
Oh, sure, yeah. If you don't get adjusted, those not getting adjusted, problems can really compound. So if it's just, let's just for instance say chronic low back pain, if you have a segment that is not moving, which is creating some sort of discomfort in the low back, and you don't get it adjusted, you're just going to have surrounding tissue areas that cause more problems. So you're going to have some sort of hypertonic tissue, like a muscle, that feels like a kind of a spasmy, achy pain where you feel like you would get up out of the chair and you want to rub it. That creates different types of tension on the bones, which creates early onset arthritis in some people, or can progress into canal stenosis, which pinches nerves basically exiting the spine, can create radiculopathy, things like that. So it can really kind of escalate if you don't get adjusted.
Now, what might be some misconceptions that are out there regarding chiropractors?
One thing that I hear constantly is that you have to go all the time, which is not untrue, because I mean, you brush your teeth every day for oral hygiene care, health, kind of the same thing for chiropractic care. If you could just get adjusted once and be fixed for life, I mean, that's not very realistic, because you move your body every single day. And when you're sleeping, you don't move it, so you put pressure on joints in that kind of way. Anytime where you're either moving too little or too much, you create different tension, stresses in the body that needs worked on.
Who might be a good candidate, I guess, for chiropractic care?
Anyone with a spine. Any joint that you have needs manipulation at some point. That's not to say every single joint in everybody's body needs manipulated, but anybody that's having pain, anybody that has anything they're doing repeatedly. So a lot of times athletes, they're using the same joint over and over again, or doing the same motion over and over again. So that's going to create some sort of repetition problem and a strain on the joint and on the spine, or whatever part of the bone. So a baseball player could be elbow. That just creates unwanted tension in certain places.
Okay. If a person has never been to the chiropractor, what can they expect in that initial appointment?
An initial exam should basically be a long conversation with the person first to find out about what's going on with them, why they're in. Most of the time people come in, like I said, at first is for an acute problem, so something that happened immediately that brought them in, because it's like unbearable pain usually. So in that, we need to find out what caused that pain, what the source is, and then to treat it. So basically in a conversation and an exam, and then a treatment. So for my type of treatment, we do a lot of muscle therapy, because 9 times out of 10, the muscle is the root of the problem that pulls the joint out of place. So if you don't address that muscular dysfunction, the joint will not follow suit. You can adjust it every day and it won't stay if the muscle tissue around the joint is not addressed. So that's really what happens on the first exam. And then we kind of talk about what kind of a plan that would look like for you. Not every treatment plan is the same, because every person's problem is not the same. So you really have to cater the type of treatment to the person and the complaint.
Okay, excellent. Okay, we're going to go to the phone lines. We've got a caller waiting to ask a question. This is Dana on the line from Smith Center. Hi, Dana. Go ahead with your question for Dr. Lindsay Gallion tonight.
Hi, Jenna. Hi, Dr. Lindsay. I am in my mid-30s and am in good shape. I feel like I carry my stress in my shoulders, though, and I try chiropractic and massage therapy and even dry needling, and it just doesn't seem to completely get rid of that stress. Is there anything else I should be doing?
That's a good question. Without doing like a full exam, it's hard to tell exactly what may be going wrong with you, but the fact that you've tried dry needling, massage therapy, and chiropractic is a very good start. Probably where you have maybe could use some work is like evaluating what you do every day. So maybe doing some consultation on your lifestyle, because that's going to create a long-term change. Whether that be, you said you're pretty active, so maybe would be if you're lifting possibly improperly, or I don't know what you do for a living, but a lot of times that is a contributor of recurring problems. So that would just be something I would want to take into consideration. You may need some other types of muscle therapy aside from dry needling. Dry needling is great, but you may need some exercise therapy in addition to that. Or you may need some Graston therapy, some ART, and just some daily lifestyle tweaking that could really give you some lasting relief.
Okay, excellent information. We're going to go back to the phone lines. We've got Cindy on the line from Hayes. Hi, Cindy. You are live on the air on Doctors on Call. Go ahead with your question.
Yes, I have a grandbaby, 6 months old, that's really colicky, suffering from colic, and somebody had suggested chiropractic care. I was wondering if there's an age limit on children seeing the chiropractor.
There's really not an age limit. For me personally, the style of chiropractic that I do, I don't cervically adjust infants, but I do basically thoracic to sacrum for infants, because essentially when they're that young they have one spinal curve, so you don't really need, in my opinion, to adjust too much in the cervical spine. So, but for colic, you are absolutely appropriate to see a chiropractor for that.
Okay, excellent. Well, let's talk about, so we're talking about 6 months. Do you have patients that are well into, their latter years, I guess, if you will?
Absolutely.
So you adjust at all ages?
Yes, the type of treatment does change. Like I said, kind of for infants, my style of practice is way different than for like a 90-year-old person. So you basically really need to cater your treatment to everything about the patient, their bone health, their spinal health, their muscular health, their overall history, if they have some sort of underlying conditions. So I may not high velocity, low amplitude adjust an 80-year-old or a 90-year-old, but they can definitely still benefit from chiropractic care.
Excellent. Now, Dana had mentioned the dry needling. Can you explain what that is?
Sure. Dry needling is historically a physical therapy technique, but chiropractors also do it now too. It's essentially where you stick a thin filament needle into a trigger point, which creates musculoskeletal pain, myofascial pain, which a lot of times is brought on by lifestyle, repetition, and posture. So that creates a broad spanning pain in like a muscle. So, but the trigger point is very pinpoint, taut banded tissue in a muscle. So let's say if you have upper trap pain, because it was brought up by that former caller, you can usually palpate a little tiny, it feels like a knot to most people. They say, I feel a knot in my shoulder. That is where you most likely have a grade 1 or 2 trigger point, where you would stick the needle directly into that trigger point. And then you can either get a twitch response by needling it with your finger, or you can hook it up to a stimulator. I do both techniques. And that just creates a little relaxation in that contracted tissue, which allows for full range of motion in the muscle. So essentially that is what creates the pain, is that muscle that's too tight, not allowing for full range of motion.
Now, we know there are people that have fears of needles. What might you say to that individual?
I am too one of those people. So it's very, very easy. So most people are familiar with wet needles that are more painful, because a wet needle is like what you get a shot with traditionally, that has a hole in it essentially that injects the medicine. A dry needle is thinner because there's no medicine coming through it. It's literally just a needle, like about the width of a sewing needle. And you can barely feel it. Where dry needling is painful is when you get the twitch response in the muscle, but it is almost always immediately followed by relief. So the pain is temporary with the dry needling.
Okay. Now, do you dry needle a person and adjust them as far as chiropractic care goes in the same appointment?
Yes. In my opinion, an adjustment is a small portion of a chiropractic treatment. So you really need to do both. So how I approach it is, first the muscle moves the joint. So you need to release the muscle first. If you release the muscle and the joint is not fixated anymore, then you don't need the joint adjustment, because it's moving properly. That's what adjustment is, essentially, is getting that joint to move better. So if you release the muscle and the joint moves better without the adjustment, you don't need to do it. But if you release the muscle and you're still not getting full range of motion, then you do need to follow up with that adjustment. And then it's very important to do something corrective, exercise-wise, to retrain that muscle.
Okay, now a couple of times you've mentioned the Graston technique. Can we explain that as well?
Yes, Graston is actually the patented name for instrument-assisted soft tissue mobilization. So a lot of other physicians call it ASTEM, I think. So it's just basically a piece of steel that you have. It's in various shapes depending on the muscle that you're targeting. It can be small, or it can be like broad about this big for like a thigh muscle. And you basically use the piece of steel to find a trigger point or a piece of adhesion in the muscle, which is where injury has happened and is preventing also, like I mentioned before, full range of motion. And you rub it on that muscle to break down the tissue, which is painful, but it's also temporary.
Okay. We want to remind you that we're talking about chiropractic care and sports therapy tonight with Dr. Lindsay Gallion. You can give us a call, 1-800-337-4788, if you have a question to ask. Let's talk about that popping sound that I feel like people are familiar with. Is there a popping sound that happens when you are adjusted?
Yes. There is.
Okay, and but that's normal.
Yes.
It should be happening.
Yep.
Okay, excellent.
The popping sound is really, a lot of people get confused, like if they're like, what is that? Is something breaking? Or you know, what's going on there? Nothing's really breaking. It's just the gapping of a joint and gas is released. So a lot of people get really addicted to the popping sound because they think we did it, right? But really the popping sound is just gapping in the joint. So your joints touch like this and there's a capsule around it. And the capsule has some fluid that makes the joint nice and mobile. As you age, that gets harder, so you don't hear as much popping as you get older and you do adjustments. But in a young person that has a nice fluid, mobile joints, it should sound kind of like that, like it. So it's really just the gapping in the joint.
Sure. Now, if a person, we've talked about in previous episodes about a person not really meshing with their doctor. If a person is seeing their chiropractor and is not feeling like they are getting the relief, when should they know that maybe they should try somebody else?
I would probably first, before you try somebody else, communicate that with your doctor. Maybe talk to them about what you're feeling and ask them questions about why you might not be progressing, because like I've mentioned before, everybody does respond differently. That's why I don't usually say, oh, it's going to take 15 visits or 6 visits to treat your low back pain, because everyone is different and people respond differently. A lot of things affect the speediness of a treatment plan. So if someone's thinking, oh, I don't mesh with this doctor because it's taken me 6 visits and I don't feel any relief yet, and my friend Becky got better after 6 visits. Well, then you should just ask your chiropractor or your doctor, like, what's going on? What can I expect? Why are we stalling? Because that just may be part of and it can also give your doctor clues about what he or she may be missing in treating you. So I would say first communicate with them. If you're really feeling like it's just not going well, then I would say think for yourself about what you're not meshing with, and then just do research and find another one.
Now, how does a chiropractor differ from a physical therapist?
Chiropractors I would say there's a lot different, but the main difference is probably we do preventative and joint manipulation. Now I know there's some crossover now because some physical therapists do joint manipulation now, but I would say that physical therapists do more rehabilitative side of things, and chiropractic is a little bit more. And I would say chiropractors are probably more passive. So when you're with a chiropractor, you, the patient, is not doing much. The chiropractor is doing the work. So we're manipulating the tissue on you. You're pretty much not doing much. You're passive. And with physical therapy, the physician is passive and you're active. So you are actively treating yourself, either through exercise or something like that. Now there is like the passive modalities like ultrasound and e-stim that both physicians can do, but that's probably what I would say is the most different.
Do some patients benefit from doing both chiropractic care and physical therapy?
100%.
And so how do you know? Do you say go on to the physical therapist? How does that work?
That's a good question. A lot of times I recommend co-treatment, probably half the time. It depends on the patient also. Like since I am my background is sports therapy, if I have a golfer that needs some passive treatment from me, it will most likely need some active treatment from a physical therapist too, in order to regain function of their elbow.
So what is the difference between chiropractic care and sports therapy?
I would say they're just basically separated in that they're the same, but sports therapy is specific to the type of techniques that I do. Because I can do sports therapy on people who aren't necessarily athletes. So like say a checker in a grocery store, they can have a sports injury of their elbow because they constantly do this every day, much like someone throwing a baseball.
Sure.
Repetition.
Absolutely. Now, what are the most common conditions that you treat in practice?
Probably low back pain, headaches, sports injury that I treat, sciatica, I treat a lot of that, plantar fasciitis, rotator cuff problems, I see a lot of that, golfer's elbow, pretty much anything pain-related.
Sure. And are there methods of treatment for those suffering from chronic pain?
There are. Now that is where chiropractic treatment and physical therapy probably gets a little dicey because it's a long-term. If you have a chronic problem, the muscle therapy and the adjusting will help. But a lot of times with my chronic patients, it's maintaining a level because a lot of my chronic patients are at a certain point of their life, like 50s, 60s, where they've been suffering for it for a long time. And a lot of that is underlying issues such as degeneration or disc issues. Chiropractic is not going to reverse your degeneration or your disc issues, depending on the severity of the disc issue, of course, because you can do some McKenzie therapy, things like that, which is active rehab to reabsorb the disc. But that's more of a long-term maintenance type of care. So it's to stall progression of getting worse and keep you living a good, healthy life. So you can treat chronic conditions, but it's more continuous.
Sure.
Yeah.
Now, do you find that if a person starts chiropractic care at a younger age that they benefit more than a person who maybe doesn't start until they're in their 50s?
100%. I would say that 100% because you don't get the postural problems that you have if you've never been adjusted or never been muscularly treated.
Sure.
That can range, like, I wouldn't say just saying getting adjusted. You don't have to go once a week from childhood on, but getting checked out regularly, just like you do with your other doctors, is very beneficial because you can catch things early. You see a lot of old ladies that have humps, and a lot of that could have been prevented probably from posture, exercise, corrective exercise, and lifestyle alterations. A lot of times now, since we have mostly desk jobs, it's ergonomics and things like that, so lifestyle coaching also. Yeah.
Sure. Hey, you've discussed a little bit earlier in the show the myofascial release trigger point therapy. Can you explain what that is?
Graston therapy is one of the forms of myofascial release. Myofascial release is essentially loosening up the fascial pulls in the muscle tissue. So a lot of people don't really know what fascia is, but it is basically a long band of connective tissue that surrounds all the muscles and joints and basically everything under the skin in your body and organs. It kind of holds them in place and allows them to move nicely with each other. So a lot of times when you have widespread pain like that, it's the fascia that bundles up around the muscle that creates the pain. So you need to release that fascia to decrease the pull and disperse the pain.
Sure. Now the one caller was asking about their 6-month-old grandbaby. What about pregnant women? Can pregnant women benefit from seeing a chiropractor?
Yes. I would say depending on different stages of what their pregnancy is, it will alter the treatment. I maybe would not do their treatments exactly the same during different stages in their pregnancy. I do have like a belly drop, so pregnant women can lay on their stomach. But during a certain point in their pregnancy, that becomes uncomfortable also. So I do most of their treatment side lying. I can still do some manipulation there. We can do some kinesiotaping, stuff like that too, to help lift. A lot of times pregnant women at the end stages of pregnancy have pelvic pain and groin pain, and a lot of that is because of the extra weight and strain on the SI joints and all that. So a lot of the stuff that we do would definitely be muscle work and fascial release. And then we can also do some taping to help support those joints and ligaments, because at the end of pregnancy you're very strained. And even right after delivering, rehab is probably one of the best things I do for my pregnant women. And they don't have to come in the office to do that. I usually send home with them. But since all those hormones released during childbirth, you need to rehab those so you don't have lasting issues in pelvic and low back pain.
Okay. You hear a lot about lately the cupping. Is that safe and or effective?
I do cupping also. Okay. It is also just another form of myofascial release. The effectiveness is dependent on the patient also, I would say. How it works is it helps move stagnant blood and bring blood flow to the surface in an injured area, which is why a lot of times you see that bruising that's associated with the cupping, the circular pattern bruising, just because that's where you put the cup and it uses suction to lift the tissue and bring blood to the surface.
Excellent. Well, thank you so much for being our guest tonight.
Yeah.
A lot of great information passed along to all of our viewers.
Yeah.
That's Dr. Lindsay Gallion from Russell Chiropractic and Sports Therapy, which she is now back in the office Wednesdays, Thursdays, and Fridays, correct?
Yes.
Yes. Our next Doctors on Call will visit with an OBGYN. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital. Experts, neighbors, friends.